You're listening to the Public Health Perspectives podcast. Welcome to another episode of Public Health Perspectives, a podcast series targeted towards strengthening the future public health workforce. We will explore the narratives of public health care professionals and gain insight on career paths that shape the profession. And now, your host, Camilla Singletary.
Hello and welcome to the show. Today I'm joined by Jade Harris, an MPH student studying at Kent State University. She'll be sharing insights about a practicum she has recently completed at Advantage Health Centers. Advantage Health Centers, or AHC, is a federally qualified health organization in Detroit, Michigan. According to its site, AHC provides quality medical, dental, and behavioral health services to residents of the metropolitan Detroit community, regardless of their ability to pay. The organization serves the insured, uninsured, and underinsured to comprehensively meet medical and dental needs throughout every stage of life. We discussed a few of Jade's responsibilities as a part of the practicum and some of her tips which may be helpful for those of you who are students or may be looking to pursue your own practicums. So welcome, Jade.
Hi, how are you?
I'm good. So just to start, can you give me a little bit of information about your background?
I work inpatient, outpatient, which is retail. I work for independent pharmacies, and I also been involved with education. One of the things that really made me lean towards public health was seeing my patients come in, and a lot of them not knowing what their medication is used for or how to properly take it. And they're what we call, I don't know if this is a good term to use, but frequent flyers in the hospital. That's really made me lean towards public health.
So how are you liking Kent State in their health policy and management program?
It's going pretty good. The only thing that I have an issue with is just not being able to have the support that I expected to have. This is my first time taking a complete online course, so it's been an eye-opener for me. And unless you're a pretty tough person, I wouldn't suggest taking online classes. But the thing that made me lean towards Kent State was, again, the tuition was pretty cheap. Once they allowed me in, I was like, okay, great. I could continue with my education and try to get this master's so I can try to make a difference in my community.
So as far as the support, do you mean like having like a face-to-face type of support, or like having access to the professors, like you can email them and get responses and stuff like that?
The support as far as face-to-face support and being able to get in contact with someone immediately. I've had one professor that's been pretty good. He gave me his cell phone number and his house phone number, so whenever I have issues, I'm able to just call him. One of the things I can say that has really been helpful is my classmates. One in particular, her name is Jocelyn. She's always available. Whenever I'm having issues or I need some help, we can get information from each other, and that's how I've been making it through the program, because she's an online student as well, and I think she's in Virginia. So we just get information from each other. That's how we find out different things, and you got to have somebody to lean on throughout the program. Because along with me being a student, I'm also a wife, I'm a mother, I'm a sister, I'm a daughter, of course, and I'm an aunt. And wearing all those hats, you just got to find inner strength and have people to help you to push you along the way, because if you don't, it'll be difficult. The other thing that comes along with having multiple roles, I've noticed, is that I have been able to maintain decent grades, but I wouldn't be considered competitive. So, because my GPA right now in the MPH program is just a 3.6, and that's not considered competitive. It's good, but it's not the best.
So from there, I'm going to segue into your practicum. Can you give me a little bit of information about your role at Advantage Health Centers?
My practicum right now at a company called Advantage Health Centers, and they're located in Detroit. They're a federally qualified health organization. I've been running statistics and stuff on their no-show rates. I'm trying to figure out where the patient traffic is going, trying to figure out why the people aren't meeting their appointments, trying to figure out which practitioners have more no-show rates than others. What's the reason why? Are there patients leaving from the facility in their area and going to another facility that's within our organization but in a completely different zip code, and to figure out what they're getting from that particular facility? Like, instead of going, you probably don't know these streets because you're in a different state, but instead of going to the facility on 8 miles, which is closer to your home, why are you going to the one on Greenfield at 6 miles? Is it because they have an OBGYN at one of those clinics and they don't have one near your house?
Yeah, I completely understand that. Part of access to care is assessing a decent location where you can get your healthcare services. For a fact, I come from a small town, it's Lake City, South Carolina, but people will drive to almost 30 minutes out, go to the hospital because they feel like they can get better care at that particular hospital. But then that just turns into those emergency rooms being oversaturated with patients.
Right. And the other thing that comes with patients leaving out their zip code is that's going to cause a higher no-show because a lot of people don't have transportation. So it's like, yeah, I made an appointment, but now I can't come over to that facility because it's too far from my home. So I'm going to cancel. Yeah, I'm going to reschedule, but then I have to cancel again. Different things just come up, and there's different issues that come into play when dealing with access to care. A while ago, we had knowledge that we had to vote on dealing with us expanding transportation, and a lot of people didn't want it because they felt like their taxes would be increased. But it was something that would have benefited a lot of people.
Thank you, Jade, for discussing your role at Advantage Health Centers and being committed to providing quality community care to the people there in Detroit. I'm sure they greatly appreciate all of your efforts, and I'm sure your organization appreciates your efforts as well. Being that you are a wife, a mother, and a student, amongst other things, if you could give a piece of advice to another student who is probably looking to pursue a field like yours or just any field in general in public health, what's something that you would recommend?
My first thing is start early. I know that that's really cliche, but it makes a difference. Get up early in the morning so you can knock out your work and you don't have any distractions or, people running around in the house to make you get distracted or, having phone calls and things like that in the morning. If you start early, you'll be able to get everything done. My other thing is make sure you always have someone to critique your work. I feel like collaboration is the best working technique. And it's good for having a systems approach because other people see things that you don't see. So if you can pass your work along to a colleague or to a friend or someone, you can have them look it over and give you their input. That makes a major difference. My other thing will be always network. It's not just about your education, it's about who you know. I started looking in May of 2017. My practicum class started in July of 2017. I didn't find the site until December 2017. And the only reason why I found my site is because I put a post up on LinkedIn, and I was like, can anybody just help me find a practicum site? I was really desperate. I was also ashamed.
The school where I got my master's from, they had a little system set up where you could search and apply for practicums and internships, but not everybody has that. So especially if you are on your own trying to seek that out, it's a very difficult process.
Right. It was thanks to this woman named Jennifer Mine. She was like, I know someone. And then she put me in contact with my preceptor, Jafar Jackson. Make sure you network. Add people on LinkedIn, go on Facebook, find groups, try to participate. If they have some type of get-together or something, try to go, even though it may be difficult for some of us. Just try to go to something so people can see your face and put a name with the face, and you can start networking. My other thing would be try to figure out coping mechanisms, and once again, find someone to lean on during your program or your career. I believe that mental health is very important. You can't get optimal results in anything that you do without being able to cope. You are not going to, you're not going to be able to present what you need to present if you're stressed out or you're on the verge of a, breakdown. You need somebody that's able to listen. Hopefully you can find someone that's going through the program with you or someone who's already been through the program so they'll be able to be there for you and let you know the different things that they did to get through.
It always sounds kind of cliche, but you cannot pour from the empty glass. And so if you are not content with yourself or at peace with yourself, there's no way that you can give your best to your work.
It's unfortunate, but you see so many people who are great minds and they're really great at what they do, but they just can't cope. People, have different things going on in their lives on top of being students. We all have different things that we're going through and working on just through life and just things that we're battling with, within ourselves. So you have to find a way to cope. This is my last thing. Set boundaries for yourself and others. That's a good way to try to prevent different issues that may occur in your life. So when you get home, you're not going to have the opportunity to prepare for a project or to follow up work that you need to follow up on with people constantly calling your phone, asking you to do stuff, or you not following through on what you said you were going to do. You have to stick to it. Try to set time and get organized. That's the only way that you're going to be able to follow through on what you need to follow through on. And that's something that I have difficulty with having a family.
Thank you for tuning into this episode of Public Health Perspectives. I'd like to also thank my guest, Jade Harris, and the folks at Advantage Health Centers. Join me next time when I'll be speaking with Dr. Allison Chamberlain in regards to the 2015 Legionnaire's disease outbreak in New York and how that led to her career at the Fulton County Health Department in Atlanta, Georgia, as well as her partnership with Emory University. Until then, I invite you to explore some of the other resources that we have available on JPHMP Direct, including a brand new series of case studies geared at public health students and others interested in epidemiology. The series is called Backstories in Epidemiology: True Medical Mysteries, and is edited by the editor-in-chief of the Journal of Public Health Management and Practice, Dr. Lloyd Novick, along with his wife Carol Novick and Dr. John Marr, an eminent epidemiologist who served as director of the New York City Bureau of Communicable Diseases during the 1970s. Each month, a new true medical mystery will be published in its entirety on JPHMP Direct. Available now is The World's Deadliest Poison, written by Drs. John Marr and Marcus Horowitz. You'll also find an interview with Dr. Marr on the site where he explains some of the inspiration for the new series and briefly relates the story behind The World's Deadliest Poison. This concludes another episode of Public Health Perspectives. Thanks everyone for listening, and if you haven't already, please consider subscribing to JPHMP Direct so that you never miss any future episodes of the show.